Hey Matt, you made it. We're here. Oh, you're mute. I can't hear you. There we go. Here. So there's people waiting. I don't know if Hannah can hear us. There's people waiting to be.
I'm letting people in. Let's let people in.
Okay.
Hi. Wow, loads of people. Hello, everybody. I see you made it in.
I did indeed. I thought at first I wasn't, but
Here we are. Hello from Lebanon, says Rita. Hello. Hello, Rita. Hello from Northern Ireland. Thanks, Hannah and Andrea, for sorting out this. Hopefully everybody's okay with the slight technical issue. And yes, thanks everyone for joining us today. Gary from Milton Keynes. Hi, Gary. I can see you too, which is good. We're hoping to see faces today if we can. At least at one point anyway. And we'll hear voices as well, if possible. Although I think, didn't Hannah and Andrea say we're expecting 91 people, so we might not be able to see everybody. 91 show up. Hello, Sufefelo Dlamini, if I've pronounced your name correctly. How's it going? You're on mute if you're saying something.
Sorry about that.
No
Hi,
problem.
colleagues.
Hello.
Hope we're all well. It's Pepelo Dlamini from KwaZulu-Natal in South Africa.
Hi. Cape Town about 4 years ago. I haven't been to KwaZulu-Natal.
Oh, yeah.
The Cape Town was nice. I did some work. The things going okay there now after the flooding? Is the flooding still happening or has that subsided now?
No, it's subsided. We're just picking up the pieces. The infrastructure was heavily damaged, and we are also entering the fifth wave. So lots of problems on our plate. And
are you and your colleagues coping okay?
We are coping. Thank you very much. We're having a public holiday in South Africa today, so some of my colleagues were unable to join, but I'll take the message.
All right.
Welcome.
Glad you've made it. Holiday. There's Pat. How's it going, Pat?
Okay, Matt. Yeah, good. Welcome, everyone. Hello.
Morning, everyone, or good afternoon, good evening, depending on where you're joining us from.
So, Pat, got a message there saying, even though we're still waiting for people to join, that we can start the session if you would like, because they're recording it, so they can share it with anybody who.
Okay, that'd be good, yeah. Matt, I think Sue, you've got the slides. We're using some slides to guide our thinking.
Should we start by introducing ourselves?
Yeah, okay. I think as Sharon's here too. Yeah, got see, yeah. Carl, Sue, yeah, we're all here. Okay, so my name's Pat Deeney. I'm the CEO of Health Action Training, and I'm experienced nurse educator and have been working with this concept of health action training for the past 9 to 10 years with Dr. Matt Jennings and colleagues. And it's very nice to see you today. We're going to give you an overview of what's meant by health action training and how your employees, your nurses actually can avail of this great opportunity. So, Matt.
Hi, yes, I'm Matt Jennings. I've been working with Pat, as he said, since about 2013, using drama techniques and actor training skills to teach communication, person-centered care, and increasingly resilient skills for nurses and nursing students. Pat's sort of being very humble there. Pat's been the head of nursing at Ulster University for about 25 years. Before that, he served as a nurse in all sorts of contexts, including the Irish Army. And he's got a very high level of expertise in disaster response training, as well as role play and simulation. And originally, we decided we would bring our two sort of worlds of expertise together with the role play simulation that is standard practice for all nurses and doctors in training around the world, with what I noticed when I was working as an actor in role play simulation, and the need for some level of actor training skills for nurses, initially just to get them through a role play, because nurses were very nervous and also struggling to think of what they were supposed to be doing in a role play, just sort of put off by the fakeness of the whole thing. So I just found, like, I've been working in applied drama, and particularly applied drama and conflict transformation for 20 years in Northern Ireland, as well as working in arts and health with people with learning disabilities, mental health issues, and people with dementia and children and so on. So there were these techniques you could use from actor training and applied drama that could be used to help people, one, get through the role play, two, to reflect on and improve their skills in everyday nursing practice, which has been going wonderfully for the last 3 years, with delivery outside of the Ulster University to nurses in Northern Ireland. But I'm starting to sort of preempt some of the presentation, so I'll introduce my friends and colleagues, Sue and Carl. Sue, do you want to go next?
Yes, thank you. Hello, everyone. It's really nice to meet you today. My name is Sue Foster. I am a nurse. I've been nursing 30 plus years, and I'm a nurse educator for the last 15, 16 years. My background is in palliative and end-of-life care, where I've worked for 23 years. And one of the key areas of teaching that I would be involved with was a advanced communication skills training, especially around challenging communication issues, breaking bad news, transition in care, different things like that. So I joined a team who I've worked with in the past in the university setting, but I joined the team roughly about 2 years ago now. So it's lovely to meet you all. Thank you.
Thank you. Carl?
Thank you. Yeah, my name's Carl Tizov-Kleister, a bit of a mouthful, but I get by. And I'm director, co-founder of the company as well. And my background is in drama and theatre. I've got a BA and an MA in performing arts and theatre, and I've worked in professional productions, writer, director, actor, technician. I've done everything you can think of in a theatre apart from selling the popcorn. Even did a bit of that once, but that's a different story for a different time. And I joined Matt and Pat on their project to do a PhD on it. And I am coming to the end of that PhD, all fingers crossed, all touching wood, that my PhD is almost rubber stamped at this point. I'm very close to finishing that. And I've been working with Pat, Matt, Sue, and everyone at the HAT team for the past 2 years that we've been going, delivering courses and kind of looking into the courses. And my main role is to make sure that the quality of the courses are high and that we're improving the quality, and that we're evaluating, and a lot of the kind of evidence we have on the courses come from the work I've been doing alongside everyone else as well. So that's what I do, and that's what I'm here for. And I'm really happy to see you all today and to chat. Thank you for being here.
Thanks, Carl. Sharon.
Thanks, Pat. Hello, everyone. My name's Sharon Fox, and just to give you a background to myself, I'm a nurse, an adult trained nurse. I was a student of Pat's in the University of Ulster, and I'm qualified come 17 years this September. My background is emergency care. I was both a nurse and a sister in accident and emergency. I moved into primary care. I was a nurse practitioner in primary care, and I am now a facilitator for health action training, but I still work in the emergency department to this day. That's my
Okay.
background.
We'll hear from Sharon later on, and it's quite important because Sharon actually has completed all our train the trainer structure, including the graduate certificate and other courses. So that's why she's now able to be a facilitator. So I think what we're going to do is we're going to commence with a bit of a presentation to guide our ideas. So if you could share the screen with us. Okay. Okay, thank you. Next slide. Matt, I think it's appropriate that you maybe just expand on what you were saying there in relation to what exactly is health action training.
All right. Want to go back to the previous slide?
Oh, sorry.
Let's jump ahead there. Yeah, okay.
No worries. Thanks a million. Yeah, so as I was saying, I was working as an actor playing patient actor with globally standard practice for the last 60 or 70 years in role play for nurses working in palliative and end-of-life care, as is Sue's area of expertise here in Northern Ireland. I'm not originally from Northern Ireland. You might be able to tell from my accent. I'm originally from Australia, but I've been based in Northern Ireland for 24 years. But I trained as an actor in Australia, and I found when I came to Northern Ireland, I was mainly doing applied drama, community-based drama workshops, often in conflict transformation contexts, working with Protestant and Catholic people together, working with people who are traumatized, working with people with learning disabilities and so on. But I was also occasionally working as an actor in these role play, and I found that the nurses were very, very stressed by the whole idea of doing a role play, and also confused about how to do it and how to get something more valuable out of it. And then I met Pat, and I just ran a little workshop with them on the spot, just to sort of help them to relax and have a few clear ideas about what to do when they're doing a scene. And then I met Pat in 2013. I'd worked in England for 4 or 5 years, but I came back to work in Derry again. And after I did my PhD on community drama and conflict transformation, and Pat and I were talking about the difficulty he was having with some of the role plays for the nursing students. And so we started out just doing a 1-hour workshop to sort of give people basic tips, handy tips on how to get through it. But the longer we've worked at it, the more we've realized there's a lot of approaches, both from applied drama and actor training, that are very useful and helpful in thinking about person-centered care, reflecting on what it is, understanding what it is as an actual practical skill, particularly the process of sympathetic presence. If you're familiar with the person-centered nursing framework from Brendan McCormick and Tanya McCants, and applied drama. So applied drama would be an inclusive approach that's based upon people's everyday experiences, using drama as a way to help them improve their lives somehow, often within particular addressing social issues, and develop communication skills, self-confidence, creativity, teamwork, and so on. And there's a huge body of evidence showing that applied drama in lots of different contexts has those outcomes of improved communication and confidence and teamwork and so on. But specifically from actor training, skills that you would teach a professional actor that can not only help someone do a role play for a simulation, but also to think about what is it that I am doing when I'm communicating with someone, or what is it they are doing when they're communicating with me. So we've actually created this kind of unique approach of training nurses and doctors and any other health professionals in actor training skills using applied drama activities and applied drama approach of inclusiveness and addressing people's everyday difficulties, how to solve problems that they're dealing with every day, and applying the two together. And in that, I think we're unique. Carl, in his PhD, has done an extensive literature review and has found no one else using the same approach. And also, I would say Carl was being very humble about his PhD thesis. Brendan McCormick says it's the best he's read in 20 years.
Calendar. At directors meeting.
Oh, well, thank you very much for that intervention, Mr. Robot. So with the applied drama and the active training approaches, we develop skills in, first of all, centering oneself, because if you're wanting to be person-centered, it's helpful if you're a centered person. So centering oneself, and this is where it sort of becomes particularly helpful with resilience and so on. We do breathing exercises and centering exercises, some of which are drawn from martial arts or yoga, but which you would use in actor training in order to become a sort of centered actor. And then attention-based exercise. So we're paying attention to not only other people, but also ourselves, and the difference between what's happening with somebody. Non-verbal communication, such skills like that, which are all a core element of actor training, particularly following Konstantin Stanislavski in actor training, the famous Russian director and actor from 100+ years ago. And then this is the part that is crucially different from the way other people might say teach mindfulness or other kinds of approaches to attentiveness or creativity in the workplace. The intentions behind people's interactions. What is it that you're trying to do? What is it that you want? What is it they want from this particular situation? Which is the way that you would approach a scene if you were an actor. And then if you start exploring a situation from your everyday life, from your clinical practice, and we explore situations that have emerged in people's actual everyday practice, how can you identify what it is that people are trying to do, and how can you work with that? So it's given people an idea of how to do person-centered care as a set of skills that you can deploy, as against a general vague concept that we should generally be nice and paying attention to people. And it sort of takes it outside of the pressure for people to have empathy at an extent where they're suffering when the patient is suffering. So as against trying to sort of put yourself in the patient's shoes, if we cultivate this skill in being able to pay attention to how the patient is feeling at the same time as being aware and allowing ourselves to feel differently and trying to help them with what they need, and so that they can understand what we're trying to do, then we can have a far more practical as well as confidence boosting experience of developing person-centered care. And over the last couple of years of delivery within Northern Ireland with dozens of nurses, we've found that the outcomes have been absolutely and far better than we could have expected, both in terms of skills and understanding of person-centered care and personal and crucially team resilience, and even in some instances post-traumatic growth. Because as you know, the last 2 years have been very difficult for nurses all over the world. And a lot of the nurses we've been working with have been sort of traumatized to some extent, definitely showing signs of post-traumatic stress, not necessarily post-traumatic stress disorder. And some of the work that we've been able to do with them, developing their skills, sharing the challenges that they're facing in their professional life, developing new ways to improve them and overcome those kinds of challenges together through sharing expertise, and doing it in a way that's fun and play-based. So, you know, it's games that you would play with kids as well as exercises you would do with professional actors. So it's been extraordinarily beneficial and effective and I think Carl's going to talk more about the outcomes of the projects we've delivered. And in terms of leadership and management, it develops a lot of the people we've worked with said this has developed their skills and their confidence in being able to work within and lead teams. So as employers, I'm sure you're quite more aware than I am of the difficulties that your workforces are facing in terms of retention, in terms of resilience, in terms of burnout, in terms of communication. The single biggest problem in health, in poor health treatment, and cause of patient complaints is poor communication, and more crucially, the most effective approach to dealing with patient complaints is improved communication. So all of those things have been coming out of our workshops and our courses within Northern Ireland, and also we've already started within the Nursing Now International framework, and we're just so excited to be able to share some of these benefits with people who I think would really value them because of the need that there exists within the nursing workforce internationally for these kind of skills and these kind of capacities. But I'll pass on to the next slide, and someone else can do the talking.
Okay, thank you for that, Matt. Just following on really from what Matt has already chatted around, I wanted to share with you some information regarding our courses, and Pat will follow on with those also. But I want to talk to you just to give you information around short courses that we currently run. And what I will say is at the end, obviously, of these brief slides, we'll have the opportunity to ask questions and we can share further information. Then the 3 courses that we currently run are 12 hours each. Coping with crisis, well-being and growth, coping with communication, leadership and team working, and then coping with role play for simulation and assessment. Now, these 12-hour courses run at a three-hour period for over 4 weeks. So it's a 3-hour period each week. We are currently run those at different times, morning, afternoon, leading into the evening. I believe that Hannah may have already shared the dates of these courses and so forth with you, but as I say, if not, we can arrange that. You will see it just very much ties in with Matt has explained as to what HAT is and what we do. Coping with crisis is a brief, few bullet points under each there to kind of give a brief idea of what each course contains. Now, what I will say is that the assessment for the short courses is formative and feed forward. And I suppose an important point really to highlight is that the courses Coping with Crisis, we have accreditation from the Royal College of Nursing and from the CPD Standards Office. We recognise really the importance, of our courses being evidence-based, and most certainly as a mark of quality. The coping with communication and the role play for simulation and assessment is currently in the process for accreditation. Covers a wide range, as you can see, from the coping with crisis. Matt has already mentioned how things have been quite difficult globally in the last 2 years with the pandemic, but really the confidence in dealing with the crisis and the importance of self-care, well-being and post-traumatic growth, leading into coping with communication, leadership and teamwork, organisational culture, person-centred practice, communication skills, teamwork and relationship management. Now, once those 2 courses, you can undertake it just as a course on its own for 12 hours. If you choose to continue with the 3 courses, that would then would be a 36-hour course, which would result in a graduate certificate, which Pat is going to chat a little about after this. The other thing being, of course, is I mentioned the accreditation and how those hours would be CPD, continuous practice development. And of course, within the UK, it meets the requirements for the 35-hour participatory learning with revalidation in the Nursing Midwifery Council. So as I say, time at the end, of course, if you have any questions. So I'm going to hand you over to Pat to talk about our other course. So thank you.
Sorry, so I was just wanting to address one question there. The question, can you do more than one course? Yes, you can. If you do the first 2, coping with crisis and coping with communication, then you can do the 3rd one, which is an assessment course where it's summative assessment of a role play and a viva in order to give people the full graduate certificate qualification. So you can do well-being and growth, crisis well-being and growth on its own, or you can do communication, leadership and team working on its own, or you can do both of them. And when you've done both of them, then you can do role play for assessment.
Yes, thank you, Matt, because actually I says the assessment was formative, but as you pointed out, the role play for simulation and assessment is a formal as assessed. Okay, I'm going to put on the next slide. Okay. Pat?
Okay, okay, thank you, Sue. Thank you for that. Yeah. So those 3 courses are done individually can add up to the award of post graduate certificate. But you can enroll for the 6-day or 35-hour course as a graduate certificate as a whole piece, and you're focusing on person-centeredness, person-centered practice, knowing self, creating person-centered and supportive cultures. So you're achieving the same outcomes in a way that you've achieved across the 3 smaller courses, shorter courses. But it's quite important because this is our most important course, because it's quite useful. It's a foundational course for train the trainer system, which Sharon will refer to later. But it's, if possible, it's better to actually do it as one piece. But as we emphasised there, we can do it in 3 small pieces as well, if really whatever suits. We do offer this, points throughout the year, and we offer it at different times as well, mornings, afternoons, and evenings across the calendar year. Assessment in this case is by role play and by a viva voce, which is like a discussion at the end, where there's a group assessment. So a small group of nurses assisted by drama practitioners will create and present a role play that reflects an issue for them in their practice, and this is then evaluated by ourselves, and we also then discuss that at the viva. Following that course, there's a further 2 courses then that actually will help the individual achieve what's known as an advanced diploma in health action training facilitation, which means that you're then a trainer, and that really is our ultimate objective, that we would actually create groups of trainers, particularly in global centres across the world. And that's quite important for you to note, because that individual then, or those individuals, will be a fantastic resource for you in your own organisation. You be in a position then, with our support, to be able to run health action training courses and address communication issues that would reflect the context in which you are operating, or the time in which you're operating, because I'm sure that circumstances will change across the next 4 or 5 years. There'll be new issues that will present for health services across the world and health service organisations. So I think we'll move to the next slide, Sue, if that's okay.
Would I just be able to point out a few things about that there, please, Pat?
Okay, Matt, yeah.
Yep. So much like the short courses, those are 3-hour sessions. So that graduate certificate is in 12 3-hour sessions. And as Pat was saying, there's a lot of benefits in doing the qualification as the graduate certificate, one of which is the development of close collaboration within the same group of students over those 12 3-hour sessions towards that role play, as against the shorter courses where it might be a different group of people each time. And that has been particularly beneficial in developing collaboration and confidence between multidisciplinary teams, when we've had nurses from a range of different backgrounds and different management levels working together, sorting through their homes, getting to know each other, becoming a support network for each other, as well as developing these practical situations. Thanks, Pat.
The other thing as well, Matt, I forgot to mention, actually, as part of this Nursing Now Challenge, we're facilitating global communication. So you're actually working with nurses from different countries and different cultures, and sometimes different languages as well. Even though the course is principally done in English, so that teamwork, if you want to call it, actually across cultures and teamwork across countries and regions is absolutely critical. And it's we're already doing this. We actually have courses running at the moment actually that have a mix of nurses from different countries across the world, and it's working extremely well. But one area they do struggle with is attendance and keeping up the attendance. That's mainly caused by why these courses are offered free to them. They perhaps struggle with shift patterns and time and so forth, and finding time to actually focus on this. Because even though we have 3 hours per week for both, the short courses and the longer graduate certificate, those 3 hours are sometimes very difficult for people to find space for. And if there was some help from the employer to actually do that, it would be invaluable. I think because we're finding that people are struggling to continue to commit to the course, but when they're there, they have an absolutely wonderful time.
Yeah, I'd say the only significant difficulty we've had in the last couple of years of working in Northern Ireland, or the last couple of months of working globally with international nurses, has been people's ability to get time off work to commit to that particular thing. So employer support would be crucial for making already are.
Okay, so I think we'll move to the next slide. Yeah, and Carl's going to actually talk a little bit about the evaluation that's the evaluation to date and the outcomes we've achieved.
Yeah, thank you, Pat, and thank you everyone else who's spoken already. As you can see the numbers up on the screen there. We've been doing a lot of evaluation of all of our courses. All of our courses are evaluated, and we have a protocol for that, and that's always in response and in partnership with the organisations and people we work with, and that's always shifting to make sure that we're measuring things that make sense. So, for instance, in a recent course, these are the numbers from a recent course we did with a local trust here in Northern Ireland, and some of the key factors they were looking at were developing the resilience of their practitioners, as well as the person-centred practice of their nurses, which is kind of a key underpinning principle across Northern Ireland and the UK, and globally it's growing. So we did pre and post tests for resilience and for person-centred practice using these 2 scales here, the Connor-Davidson Resilience Scale and the Person-Centred Practice Index. And you can see the headline scores there were pretty astonishing to us. We found them very, very moving and significant. Is that we've been able to increase the mean scores for resilience in the group by 35%. And digging deeper into that kind of number there, some of the significant things that came out for us is we had some people at the pre-test phase who were showing numbers of resilience that would indicate or could potentially indicate that they were suffering from severe depression or even displaying signs of post-traumatic stress, as Matt was saying earlier. Now, why I say that is because in the post-test surveys we had enhanced that bottom number, the number of people who were displaying that, to a baseline level, to a level that would be indicative of a normal nurse in their day-to-day activities. So essentially, through the course, we had taken someone who was feeling severely depressed or possibly traumatized to feeling, at least in terms of resilience scores, at a baseline level, feeling better about how they can cope, which was really, really validating for us. There were the really big increases in their ability to adapt to change, how they coped with stress, and how that stress helped to make them feel stronger. And one of the big increases from that Connor-Davidson Resilience Scale that we saw as a particular subset of questions was their ability to lead and their preference to lead. So beforehand, they might have said they didn't feel like they were able to lead, but as a result of the course, they felt much more able to lead and take the lead on things. And that was really encouraging. And in terms of the Person-Centred Practice Index, you see there we had sort of a 16% increase in person-centred scores, and it's kind of difficult to present the PCPI scores as a single number, but this is the way that we're doing it right now, and we can dig deeper into the numbers there, which we will. So some of the things that we expected to increase with Person-Centred Practice Index were things like sympathetic presence, which Matt has already mentioned, and other key processes and communication skills. Some of the areas that we increased the most were developed interpersonal skills and places like that. But we were really surprised to see that the biggest increases were in these 4 areas. There were knowing self, clarity of beliefs and values, ability to make shared decisions, and power sharing. So what we found is the courses are doing work much deeper than the levels that we had expected them to. It wasn't just increasing their ability to communicate, increasing their ability to perform sympathetic presence and the things that we explicitly thought we were doing. But it was also fostering the group's ability to feel they knew themselves, to self-reflect, to self-actualize, to have a clarity of their sense of belief and values at work and as a nurse. So those scores were really, really encouraging and really surprising. And we can talk more if you've got any questions about any of those numbers and any of the depth of that information. We'd be happy to talk a bit more about that. That's a very broad stroke of what we found with a recent course. And the last number there, learning experience, we do a general module evaluation for every course we run. And today it's about a 96 to 97% amount of people strongly agree they had a positive experience working with us on a HACC course. And 98% of people agree that they felt that their quality of practice was improved. That includes things like their ability to perform person-centered care, their ability to be performing self-care, their teamwork and their leadership, and so on and so forth. So that's a broad stroke, kind of, this is a recent course we've done, numbers from it and the impressions we get from the course. What I think would be really good to segue into from here is we can all look at numbers, we can all see these, and I can explain to you what we're seeing from survey scores and from interviews we've done, but it might be nice to hear from someone who's actually done the health action training course themselves. So maybe now is a good time to invite our wonderful Sharon Fox.
Carl, sorry to interrupt again. Just wanted to ask, do you want to mention, maybe that was from the most recent course, but about the results that have come out of the previous 6 versions of or 5 or 6 versions of the graduate certificate? How have they been similar kind of figures?
Well, it's tough to say. They vary a lot, obviously. This is just this is the most recent graduate certificate we ran with a local trust in Northern Ireland. I'm doing broad strokes analysis of everything at the moment. This is a particularly surprising course in terms of the numbers and where we saw things, but it does reflect generally where we are and what we do. We do very well with resilience scores. We do very well with the knowing self, clarity of beliefs and values, shared decision making, power sharing, as I said, from the person-centered practice index. So yeah, course by course is going to be different. Every group's different, but these are the broad strokes that we're seeing. But definitely in this particular course, there were really, really striking things that came through.
But in every case, we've got sort of 10 to 15% increase in both categories as a minimum.
Yeah, I would say even resilience scores, we can say about 20 or so % as an average, fairly comfortably, and person-centered practice index. And I should mention as well, with the person-centered practice index, it suffers from something called the high ceiling effect. And I've worked quite closely with one of the creators of the index, who's my supervisor, and she's explained this to me, that having any shift, any change in scores for the PCPI is significant, because people generally score it quite high anyway. So having any increase is kind of doubly important. But that's something we can talk about a bit more if you're interested in it. But as I say, I think it's going to be far more useful to hear from someone who's experienced it. So Sharon, if you're there and you can hear us.
I can.
Sharon, I'm just going to stop the share, okay?
Yeah, no problem, Si.
Thank you.
Brilliant. So hello everybody again, and thank you, Carol, for introducing me so nicely. So I've told you my background, but just to give you an idea of why I decided to do any form of health action training. I was a nurse practitioner in primary care, and at that stage our face-to-face contact had decreased, so we were going to be taking up a lot of telephone consultations with our patients. So health action training had training out for telecommunication. So I thought it would be beneficial for myself and my practice to undergo telecommunication training to try and enhance my communication skills and try to prepare myself for what was coming with telephone interactions during COVID. And I did get that. I did get lots of communication skills, as in how to communicate with someone. However, I come away with a lot more than communication skills. it was the first time in my near 17 years of any form of training that I have been to that I felt I was at the center. How was I doing my being? How was I coping? And it was done in a very respectful manner, very kind. And I soon realized that through the group that we were all struggling in the current time. We were kind of in an unknown situation of what was coming. There was a lot of pressure, work demands, targets to meet, and unknown really. And health action training just gave me a chance to breathe. And when I say breathe, they give me the chance to just be present and where I was at that moment. I was struggling. I was finding it difficult to adjust to all the changes that was in our environment, which we could not change. However, they give me the tools to recognize it and just sit with it and say, okay, this is where we're at. However, beyond that, through doing breathing exercises, centering ourselves, it gave me a calmness in myself. And I soon realized that when I became more aware of myself and the need to care for myself, that it had an impact on my practice. It had a positive impact on my practice, because, you know, often when we think about communication, we would all say, oh, well, I think I'm an effective communicator. Really, I had never taken the time to actually focus entirely on me as a communicator and what was being communicated to me. And I look at communication in a very, very different manner since having done any health action training. When we think about it, any problem that has arose through communication. It's communicated to us that there is a problem, but the resolution of problems is also through communication, which is interesting. And it's through health action training that grounds you, it centers you, it focuses you, that you pick up on the cues of how to respond and present yourself in that communication as well. So that was fascinating. From people that are attending this today that are from a management background or the employees, and I know that we're all under fierce demand from nursing at the minute, that there's shortages, can't get shifts covered, and to retain staff, and that's not just across nursing, that's in community sectors as well. So it's not something that's unknown. But what I can say from health action training to talk about that is I come into this course very tense, very, very tense. And I being honest, I didn't fully understand the drama, the applied drama. How could I? I'm not a drama practitioner. I'd never participated in any drama in any sense at all. And at the beginning, I thought to myself, how is this going to help me in nursing? How is me practicing drama techniques going to actually help me in nursing? And it really did. It really, really has, you know, because we are in these roles day in, day out. We are communicating constantly with patients, relatives, members of the multidisciplinary team. But by doing the role plays and so forth, it has focused me. It has also given me other tools that I can use to create a more positive result or outcome in that communication. But from an employer's point of view, what I'm really trying to get across to you is I did not leave health action training tense. Once I had completed my health action training, I did not feel tense in the manner in which I had started it. I had a refreshed and renewed outlook, not just on communication, but on nursing and on myself. Health action training gives me the chance to refocus, see the priorities in my practice and how I wanted to proceed as a leader for myself in the practice in which I deliver. And And I think for employees and managers, if you have a team that is coming away, or members of your team coming away feeling that way, they're going to have a lot more of a positive outlook on their practice. And if staff feel that they have a voice, because in one of the slides there it was said about finding your voice, health action training helps you to find your voice and to use it. You will have staff that will remain in their workplace because they feel valued, and they feel a part of the team, and they can see the value in their work. So for managers and employees that are thinking, how can I afford to give this time? Yes, I understand it is difficult to give the time in the current crisis. However, long-term retention of staff and for future development, this course is invaluable, and they will come away with a lot more than just communication. You will have a lot more confidence from your staff. You will have people that are feeling their self-worth, and that will reflect in their practice, because once I had completed my health action training, it was like a light bulb went on for me, because I thought, I can really see the value and the place of this in nursing. And I've had the pleasure to go on to do train the trainer because I believe in it so much. And I have worked with nurses from across the world. And again, it's universal. We are a universal team. We have the same issues across borders, countries, seas. It's the same things. It may be different subjects, but we all have our challenges. But health action training through role play and simulation brings us together as a team. We feel, you know, at the beginning when I thought, oh my gosh, I'm going to have to sit in front of a camera and actually do role plays and play a character, I thought this is very foreign for me. I don't know if this is something I can do. But health action training techniques, especially from Matt and Carl, who come from a drama background, they ease you into it very, very subtly and gently. And you soon realize that the role plays are nothing different than what we do in day-to-day practice of our roles. However, we're more aware of what we're doing because we're placed in a role play, and you know, you feel like you're acting, but you're not really. But what I learned from that was through the team, there was open communication, open dialogue regarding the role plays. We had the opportunity to actually re-watch recordings of ourselves in the role plays, and that opened up discussion regarding how you were presenting yourself, how you came across. And often sometimes what I thought I was presenting wasn't being what was interpreted, perhaps by the others in the team, and you automatically start to sit back and reflect. So you go into a reflection process then of, okay, so what is it that I'm doing in my communication that I'm not getting across what I think I'm getting across? And that can only be achieved through the health action training techniques that is delivered in this course. So you become a more reflective practitioner automatically in this course, which leaves you coming away with kind of an action plan in your head of how you're going to approach future situations regarding communication and how you present yourself, which leaves you more mindful for practice as well, you know, especially in issues where we are under stress and potentially can react in a very quick, haste manner, whereas health action training teaches you to calm, just take a breath, focus on what is being delivered to you and how you're delivering it back. But for the case of resilience, I don't want it to be interpreted that you need to become resilient, that it's something that you have to be in order for your practice. That's not what health action training will give you. That's not what I received from health action training. What I received through health action training, as I have said, is an awareness of me in the process of our practice. Me as in the sense that I'm present. So when I'm present, I'm open to what is in front of me and who I'm caring for, and giving me the opportunity to self-care. So by doing and learning these techniques, I have been able to come away, as I say, refreshed and more focused. And that is where I have gained resilience within my practice, because I have learned that through the techniques that I have learned through health action training, and I'm now trying to facilitate myself, that it's so important that we focus on ourselves in order to be person-centered, because if we're not centered on ourselves, we cannot provide the care and attention to those that are in need of our care. So that's how I feel I have become resilient. The scores that Carol has mentioned is absolutely no surprise to me, because having personally experienced the effects of health action training, I felt very positive coming away from the training. So for employees and managers, just think beyond the release of the hours every week. Think of your bigger picture of a team that you're trying to put out into practice that is more confident, happier and more resilient than themselves, because you will have a task force that is more focused on the care that we all want to provide, good care, and person-centered care. And this is what health action training will give you, the staff.
Okay, Sean, thank you very much. Thank you.
No problem.
As you can see, not only do we improve outcomes for individuals, but also organizations, and we create very passionate leaders. So Sharon's a passionate leader.
Pat, we're sort of getting near the end of 11, but I think we can probably go on for another 10, 15 minutes for questions. What do you reckon?
I was about to say that, Matt. I was just saying that we have opportunity now for questions or comments, whatever people, the floor.
Pat, I noticed in the chat there's been a few people trying to sign up on the forms, I believe. Hopefully we can get the forms working and emailed out to everyone who needs it. I think there'll be, yes, Gary, I see your hand up. Is that Gary?
Sorry, I wasn't going to interrupt what you were saying then about the form or anything. I'm just interested. I know that you said about a postgraduate certificate, and I've worked in universities and understand that. But my question here is, I know you mentioned about the RCN in CPD as an example, but who is the accreditor for the graduate diploma? Because usually it's university or equivalent, and I just wondered who it was really.
It's still, Gary, it still remains the Royal College of Nursing.
Okay.
Still the Continuous Professional Development Office of the United Kingdom.
Okay.
As regards to university, obviously we would facilitate people who wanted to actually use a process of what's known as accreditation for prior learning.
Okay.
APL. So that would be facilitated, but no, we don't do a university. It's just the professional body.
But Sue might be able to say a bit more about Royal College of Nursing accreditation at a postgraduate level, perhaps. I mean, I think it's the same as for at a university level. It's just the RCN as the body. Is that right, Sue?
Yeah, it's a professional body accreditation and recognises the 35 hours or the 12-hour course. And I'm sure you're very au fait yourself for that, Gary, as Pat had referred to. Anyone who wishes then to continue on in some stage with any academic work at university most certainly can apply for prior learning and with the CPD hours from the course, 12-hour course, 35-hour course, whatever that may be. And alongside the Royal College of Nursing, we also have the CPD Standards Office. And in the south of Ireland, we have our course accredited with the Nursing and Midwifery Board. I suppose we just realised the importance of as well as the quality marker and being evidence-based, but the importance of our courses being accredited and for CPD, that it can be used elsewhere also.
It's probably worth mentioning as well that if there was further work, Gary, if you're thinking yourself or anyone here is thinking if there's further work that you wanted to do and you're in a country that isn't UK based, doesn't recognise the RCN or CBD Standards Office as a form of accreditation as much as it is in the UK, what we can do is work alongside you to find accreditation that does work and go through the process of doing that and helping alongside that.
That's absolutely fine. Don't worry, I am in the UK and everything else. I'm not working in a university. I have been a program director previously, but I work as a head of practice education in an NHS trust. I think it was the fact that when it came to the RCN, I've never recognised it probably as an education board to award a postgraduate certificate or diploma in that sort of things, because usually it's with some educational elements that come into play. So what I'm saying there is, I know they did ours, I know they did their own credits, but I didn't realise they're actually like an educational institution that gave certificates.
Similarly, we're currently working with the Royal College of GPs on developing a very similar course with GPs with a Dr. Brian Sweeney. He used to be the head of the BMA in Northern Ireland and is on the editorial board of the BMJ and various other bodies. And as Pat and Sue were saying, we're working with not only the Nursing and Midwifery Board in the South, but also the Irish Nursing organisation to get accreditation in those contexts. So as Carl was saying, in any particular country, we can work with whatever bodies are working.
Thank you for your time.
On the chat box there, the one maybe we could deal with is, can I enroll other nurses who are not doing the Nursing Now Challenge Fellowship Programme? My answer would be that would be something that you could actually discuss with the Nursing Now Challenge, that people might want to enroll on the Nursing Now Challenge, and that would be facilitated. But also then we can discuss individually with you as an organisation, because there are examples of people wanting to have a specific group of nurses helped with a graduate certificate in particular, and that's discussed individually with us. But to answer that question, the answer would be, if they're not, they need to be on the Nursing Now Challenge to enroll them to avail of these courses, and then but the opportunity is there for further discussion to enroll people on the Nursing Now Challenge, and also then to discuss with us individually. People are asking about the costs as well. Are there costs associated with the course? If you're on the Nursing Now Challenge, or part of the Nursing Now Challenge, they're free at the point of delivery because it's funded by Burdett Nursing Trust, which is a charity based in London, and they fund the Nursing Now Challenge, and that means that the courses are free at the point of delivery.
So that's over the next 2.5 years.
Yeah.
So we've got 3-year funding to deliver 3 graduate certificates per year and 6 short courses per year, and 1 Train the Trainers program, which involves another 2 courses per year via the Nursing Now Challenge, funded by the Burdett programs, to which we are eternally grateful to both Nursing Now and the Burdett Trust. But that means that if you are Nursing Now, you can do all the short courses or the graduate certificates or even the Train the Trainers program at some point over the next 3 years for free. However, you might wish to sort of bring us in to work more closely with their groups of people within your context. So for instance, if your NHS trust or your university or your private health insurance provider or your hospital would like us to work closely with a group of people in your team, there are costs outside of the Nursing Now Challenge funding. And if you approach us through our website, you'll be able to sort of like look at those. And they are also negotiable depending upon the country of origin. So there are prices that are set there, but we can be flexible if we need to tailor package to a context where the resources are a little bit more spare. Superpello, you have your hand up.
Yes, thanks for the presentations. They were very clear, and for the responses on the chats, much appreciated. So I am part of the Nursing Now Challenge, and I try my best to be active. Although I'm still lost from time to time with what is happening, and I don't participate in everything, but I would want to do that. But what if then the group of nurses that I come with or that I invite to the course are not part of it? Must they first join the Nursing Now campaign and then we all can do the course, or they can then join through me? Thanks.
I'd say that would be one where Hannah and Andrea would have to sort of give us a bit more detail on that, because we're not the gatekeepers via Nursing Now. Personally, as far as we're concerned, nurses who are not already registered for Nursing Now are welcome to join, but we would encourage them to join if possible. I mean, as far as I understand it, joining the Nursing Now Challenge is fairly quick and easy and free. So, I mean, it's not that hard really to fill out a form, but we have had nurses who have joined us who have not been members of the Nursing Now Challenge to start with. We also have drama practitioners involved who are there by invitation from lots of different countries around the world, including Africa, Nigeria, Ghana, Uganda, South Africa, as well as Hong Kong, Singapore, Malaysia. At the moment, that's just, and Italy and Israel. That's just drama practitioners we have working alongside the nurses at the moment. So basically, our simple answer is everyone's welcome, and we would love to have you and bring them along. And then we'll see if there's forms that need to be filled out. We'll help them fill them out. Somebody also asked a question about translation services. Now, we don't have translation services as a part of the course. And what we have been doing is people who have a greater facility in English, who are participants, have been helping people who speak the same language. So, for instance, we have people who are Hindi speakers who've been helping people with less facility for English understand what's happening. We've had other translation. We've had 2 Jordanian midwives, or one was a pediatric nurse. I think they're both pediatric nurses. Doing role plays in Arabic together, so you can work in your own language. We would like, once we have the Train the Trainers program up and running, to train people who have facility in specific languages such as Arabic or Spanish or whatever, so that we can then, when we're working with you perhaps, or your qualified trainers, that we would be able to then have your colleagues as potential sort of interpreters. I can speak French. I think Pat's got some Irish, but apart from that, we would be looking at the participants and eventually the qualified trainers from their countries to be the experts in that language, which is one reason why we want to do the Train the Trainers program, because we don't want to be forcing everybody to do everything in English. We would love to, cultural imperialism, that we would love to be able to sort of develop an understanding of the skills that could be transferred throughout particular cultures and particular languages by people who are fluent and from those. I mean, whatever communities we're working with, it's all about empowering the members of those communities, or I prefer enabling, but we won't go into the discussion about enabling versus empowerment.
So just to emphasize there, what Matt's saying is our ultimate goal is these global hubs, hubs across the world that actually are centers for health action training, and you're in a position to influence that big time. A question as well that came up was, are national nursing councils and associations aware of this program? The first answer to that would probably not, and we would be calling you to actually perhaps make them aware of it. And then if there's any follow-up discussions that are required with national nursing councils or associations, we'd be delighted to do that and provide more information and so forth. We haven't had the need to do that even at the UK level, because we actually, our qualifications are, even though they're professional qualifications, they're not needed to be supervised by the national or the Nursing Midwifery Council, but we do have interaction with the council, on an informal basis, and the same would apply to the Republic of Ireland as well. So that model can be easily carried across to any country.
That's from Century. Century attends one of our courses, the Grad Cert, on the Monday. So Century, if you want to discuss it any further, come, well, not this Monday. next Monday, feel free to have a chat with us.
Yeah, it would probably, as you say, Sharon, yeah, it would mean like a follow-up meeting with some representative of the association or something like that, just for information. But it's a good idea to make them aware. Very good.
We're rapidly coming up to about 10 past now. I don't want to take up too much of your time. And if you do have any extra questions for us, specific questions, I think our emails will be shared through Nursing Now, or you can reach us through Nursing Now and they'll forward it on to us. But to address the kind of question here from James, what's the steps for enrolling in the course? It's a really great question to finish on, so we're clear. So the first step is to become a member of the Nursing Now Challenge, if at all possible. And then to follow the links that Hannah and Andrea from Nursing Now have put into the chat box there, or you'll see through social media or on the Nursing Now website, to then enroll in the HAT courses. So step 1 would be join the Nursing Now Challenge. Step 2 would be join a HAT course. That's the easiest step-by-step way to get yourself on the course or some of your nurses on the course.
Fill out that form. And once you've filled out the form, we will have your email addresses from Nursing Now, and then Sue will send out any information anybody likes for anyone who wants to inquire about the short courses, and Pat is the man in charge of the graduate certificate. We have from Hannah and Andrea, where we do have, if we're willing to stay on, Carl and Pat and Sue and Sharon, another 5 minutes, if everybody else would like to stay on. Well, Super Paolo, you had your hand up again a minute ago. Did you have a second question, or was that a legacy hand from the previous question? But if that is all the questions, then we're probably okay. Does anybody have any last comments from our team?
Just thank you all for being here and listening to us, and hopefully you found it enjoyable. As I say, any information extra you need from us, any questions, more than happy to answer them and work with you to solve those. If you have a team that you want to bring through into health action training, get in touch with us and we'll make it work.
And somebody else was asking about more information about our work and courses. We have a website, but we also have a couple of publications about our work. So if you wanted to email us or go to the website or both, then you would be able to sort of read some chapters that have been written in anthologies. I've just put in the name Health Action Training rather than just the website address. Anyway, you look up Health Action on the website, email us through that, email us directly personally if you like, instead of the info one, and we can also share you the chapter. One was in a book called Performing Care, published in the UK, edited by Professor James Thompson Stewart Fisher, and another one was published out of the Chinese University, Hong Kong, on community arts and power. So if you want to read, we got reading material, and if you want to chat, drop us an email. And if you want to register or find out any more about how to go through the process of registering via the Nursing Now Challenge, drop them an email on the address that's just been posted in the chat box, info@nursingnow.global.
Okay, thank you very much.
Thank you so much for your time, and thank you so much for your wonderfully brave and generous and courageous decision to be nurses to help save the lives of people like me and my family. I think one thing we've discovered is get nowhere near enough positive regard. And I don't mean just clapping on a Thursday night for the NHS. I mean actual appreciation for the dedication and the value that you have given to your work in saving our lives. So thank you.
Thank you, everyone.
Thank you, folks.
Yeah, thank you,
Bye-bye.
everyone. Bye.
Bye-bye.